So let's go ahead and dive in. In your opinion, what has been the most meaningful recent advance in the treatment of rare blood cancers like ALL and LBL?
I predominantly treat children with acute lymphoblastic leukemia or lymphoblastic lymphoma. In that space, I would say the most exciting recent advances have probably been in terms of our ability to treat children with immunotherapies. Immunotherapy meaning that we can harness the patient's own immune system to help us fight off their rare blood cancer. The two that come immediately to mind are CAR T-cell therapy, which I think has made a pretty big splash for the last couple of decades in terms of its ability to take a patient's own T-cells, which is one of their immune-fighting cells, engineer them in the lab such that they are sort of cancer-seeking cells, give them back to the patient, and see eradication of disease. So that's been incredibly exciting. Another exciting advance is our ability to take a part of an antibody that detects B cells, so including the malignant B cells of the leukemia, and then link it to the T cells, which are the sort of cancer-fighting cells in the body, and really allow the patient's body to attack the cancer cells. Those two modalities have been incredibly successful in the relapse setting. What's exciting to me right now is that we're saying, why save those for relapse? Let's move them and see if we can prevent relapse into the upfront setting. So that, in my opinion, is the most exciting space that we're in right now.
So Dr. Rao, where do you feel the science needs to go before we can have even bigger breakthroughs in treating rare blood cancers?
I think that's incredibly great question. I think the way we used to think about making our therapies better and more effective is just let's give more. Give more of these medicines that we know sort of more preferentially kill the cancer cells, but also have dramatic effects on all the normal cells as well. And so I think we've realized that we've hit the ceiling in terms of how much we can push those traditional chemotherapy agents, and now we need to find better, more directed ways to treat the cancers. And so science needs to advance in terms of understanding better how the cancer cells differ from normal cells, because only then can you design something that's really specific to the cancer cell but better spares the normal cells.
Can you give us a sense of why continuity of care is so important for patients?
You know, I think while we can sit down with a family and say we have a 90% chance of curing your child's leukemia, that cure rate is contingent upon them completing an entire complicated course of therapy that spans 2.5 years. And we know that it's incredibly important for them to adhere to that therapy plan very strictly, to miss as few doses as possible of every single medicine that they get. And families totally get that. They understand it. They are very strictly adherent to it because, God forbid, we do anything that would compromise that 90% chance of their child being cured. So when we have drug shortages, it's awful to sit down with a family and say, this is on your therapy plan. We know it's a very important part of that long therapy plan, but we don't have that drug to give you right now. Every parent's first question is, what does that do to my child's chance of being cured? And often we don't know, but it's probably not good, right? We have lots of data to say that missing multiple doses of a drug or even one dose of a drug probably isn't the same as completing every single dose in terms of our ability to cure patients. So it's exceedingly important that all the stakeholders, that doctors convey to pharmaceutical companies how important it is to keep a steady supply of these medications, that we talk to insurance companies to say, yes, we really need this, and we don't need to call you for pre-authorization to give this medicine because it's critically important. And of course, we emphasize to the families the importance of not missing doses, so set your alarm to make sure you give it. So I think everyone needs to understand it, from a governmental level to an industry level to a provider level to the family level, to make sure that these drugs don't fall into shortages as seldom as possible.
So in closing, do you feel hopeful all rare blood cancers will be preventable and or curable in the future?
Curable, yes. I think we're getting really, really close in childhood leukemia. We are literally curing, over 90% of kids who are diagnosed with B-cell ALL and getting very close to that in T-cell ALL as well. So we're so close to achieving curing almost every single patient that now it's actually pretty cool that we're saying we're curing so many. How can we still cure that number of patients without causing all the short-term and long-term toxicities? So, I think we can cure most patients. I think we need to do it in a gentler way at this point. And so we're sort of shifting our next set of clinical trials to sort of start asking those questions. Can we maintain those really high rates of cure while causing less toxicities to our patients as well?
Thanks for your time, Dr. Rao. I really enjoyed our conversation, and thanks for sharing your thoughts with all of us.
It was a great pleasure. Thank you so much.